From the San Francisco Public Press, you're listening to Civic. When the COVID-19 pandemic hit, an alarming trend began emerging among the tens of thousands of Mayans living in San Francisco.
The Mexican consulate, they said to me, lately we have to issue certificates of people dying of overdoses.
Indigenous Latin Americans are categorized as Latinx, even though many speak limited Spanish. That means vital information, like the dangers of fentanyl, may not be reaching the population. And service providers say culturally sensitive treatment programs are crucial for healing, but they're nearly impossible to find.
Indigenous people, we understand as human beings, we're sacred. If I can understand that place, then my actions are going to be different.
But a campaign for change may be gaining ground.
Requests for proposals I have seen for behavioral health, they are including Spanish-speaking and Maya-speaking communities.
I'm Sylvie Sturm, and this is Civic. It's been a year and a half since I began reporting on the origins and devastating effects of a drug epidemic that gripped San Francisco. And 6 months ago, I started looking into why the Latinx community was seeing a rise in fatal overdoses. That's when I discovered that a largely overlooked subgroup of the population was dying at an alarming rate. They're Indigenous Mayans from the Yucatan Peninsula, the large landmass in southeastern Mexico that separates the Caribbean Sea from the Gulf of Mexico. And the struggle of Yucatec Mayans was largely invisible to those in the public health sector. Why were they disproportionately affected? What unique challenges did they face in accessing help and resources? And how could their plight escape the radar of those tasked with combating this crisis? Yucatec Mayans are descended from an ancient civilization renowned for achievements in architecture, writing, mathematics, art, and agriculture. People from around the globe flock to present-day Mexico to visit what remains of Mayan pyramids, temples, and observatories. But despite the legacy of their ancestors, which attracts millions of dollars to the region, modern-day Mayans face systemic discrimination, limited access to education, healthcare, and economic opportunities, and limited political representation. This situation leads many to seek better opportunities elsewhere, and I recently found out that tens of thousands of them have made their way to San Francisco. Many of them find the success they're looking for, but plenty of others endure hardships they never expected.
They come in to reach the American dream. And the American dreams sometimes became very sad for them.
That's Lydia Candela Chan, a Yucatecan of Mayan descent who has been in San Francisco for more than 40 years. She's the executive director of Asociación Mayab, an organization based in San Francisco that develops programs focused on the health and well-being of Yucatec Mayans living in the city.
The only thing why they come in here is to make money, to give to their families a better life. That's what they think. That's their goal.
But the language barrier is a major hurdle for many of them. 99% of the 800,000 Mayans from the Yucatan speak the Indigenous Maya language. It sounds like this. This is Hilario Chicanul, a Mayan language consultant on the film Apocalypto, saying that he went to a casting call in Cancun, was selected, and then went to Mexico City to get the script. Many Mayans come to San Francisco speaking their indigenous language, and they might speak Spanish as a second language. So landing a job can be a huge struggle.
Because when they come here, sometimes they borrow hundreds of pesos, thousands of pesos. They sell their properties. They lead their family, kids, some they already died. They don't even reach anything. Because all the time they're thinking every day, how am I gonna do that? No work, how am I gonna pay my debt? And they became so disappointed that one friend said, well, come, let's go drink a beer and talk. From that, they start more and more and more. Suddenly, they live in the street. Suddenly, they die. I see so many. I never think before These people from my country, they used to live like that. I never think about until I saw the reality. My family is a different situation, you know. I came in a different situation. No, it's tough.
Of course, numerous Mayans do achieve success, and for many, that's thanks to something the people are famous for: their culinary skills.
They are the best cooks here in San Francisco. Any restaurant that you go, you will see one person from Yucatan.
But when the COVID-19 pandemic shut down the restaurant industry, job losses led to financial setbacks that many couldn't cope with.
Hola, hola. How are you? Are you okay? You don't want some coffee? Hola, ¿cómo está? Banca Mendicta. ¿Eres de Yucatán? No, eres de Yucatán. ¿De dónde eres? Guatemala. He's from Guatemala. Tengo café. ¿Quiere café?
Every weekend, Aurelia Ramirez buys a dozen slices of sweetbread and a box of coffee and fills a tote bag with pamphlets about local support services. Then she spends the rest of the day walking through her Mission neighborhood, connecting with people living on the street.
Our job is to check the people if they okay.
Ramirez is a community ambassador for the City of San Francisco's Office of Civic Engagement and Immigrant Affairs. She came to San Francisco 23 years ago, and she wanted a job that allowed her to help people like her, Yucatec Mayans. I joined Ramirez during one of the rare days when it wasn't raining in February.
I like to help people. I like to see people to be okay. It's sad, especially Latino people. It's sad they don't know what they can do, especially Yucatan people. I say this job is a good opportunity to talk to them and try to help.
During our walk, Ramirez encountered at least 3 people from the Yucatan she called paisanos, and she took advantage of their shared culture to connect.
Hola, hola, ¿cómo están? ¿Qué hacen? ¿Paisano, Bichawani? Tengo un café, ¿quieres un café? ¿Dónde está el otro paisano? Contigo estaba platicando, ¿no? Contigo, ¿verdad? Tengo que practicar mi Maya. I talk to him all the time because I want to learn Maya language.
You don't know Maya?
Not too much. That's why I talk to him. I want to learn more.
She often took a maternal tone with people she approached, like a couple drinking from king cans of Budweiser. The man tells her he's from the Yucatan, the woman from El Salvador. They were grateful for the coffee and receptive to information about where to go for medical care, showers, and laundry, but he seemed eager to get rid of her when she began lecturing them.
Mire, mientras usted no busca ayuda emocional, el alcohol siempre va a decirle tómame, tómame, tómame. ¿Por qué? Porque el alcohol nos pierde la cabeza y nos dice, esta es tu medicina, con esto vas a estar bien. Pero no es así.
Ramirez tells them that as long as they don't seek emotional help, alcohol will always be calling, drink me, drink me, drink me.
El alcohol lo que nos hace es solamente recordar cosas malas y estar tristes.
She says,
El alcohol no es la medicina que necesitamos.
alcohol clouds our judgment. It tells us this is your medicine and this will make you feel better, but it's not true. Alcohol is not the medicine we need. It's a way to escape from our reality, and it only makes us sad. We have to make an effort. We have to push ourselves to try to move forward with our lives. We have to overcome our shame and ask for help. It's very difficult, but we have to seek help.
Es muy difícil, pero hay que buscar la ayuda. Sí, si quiere comer algo, por acá hay una taquería. Sí, vamos a caminar un poquito por acá. Sí. Bueno, cuídense, okay. So here he want to eat, I can buy food. Money, I can give money to them, but if they hungry, I can buy food for them. But they say they okay. It's sad to hear what they say. They say if I have a little house, I can do everything and go to work. But I don't have a house. And we always give information about shelters, but they don't want to go.
Right.
They say it's not safety, it's dangerous to be in shelters, because other people mental problems try to attack them. That's why they don't want to go. They feeling free outside and more comfortable. I know we sharing a lot of resources, but sometimes they have a wait list for shelter, wait list for help, and they don't want to wait. They want to help the help at the same time. And the help, sometimes they don't have it. It's only wait list. That's one problem they have.
As we walked away, I reflected on the couple's initial eagerness when we first approached them. They were closely reviewing the material Ramirez shared, noting the medical services' hours of operation. Now I wondered whether they would use these services after all. This was not the harm reduction approach that the city promotes, but I get how nearly impossible it must be to resist telling people to stop their unhealthy behavior, especially when it's your own people. Ramirez has seen the suffering that the pandemic has caused in her community and how so many have never recovered.
After the pandemic, they lost the job, lost the house. They don't have money. What they can do? Just go out. Maybe some friends help 1 week, 2 weeks. But after that, they don't have more money. They don't have more friends. The friends is not going to help all the time. And they prefer to go out. And what they can do? Just drugs. And now, some people, it's not okay anymore. I talk to my friends, these people is in the moon. They don't recognize anybody. They only talking crazy things. They don't have a focus anymore. And it's sad because these people has a family. And the family looking for them. Go back to Mexico. But a lot of people are passing away.
After the pandemic began, the rate of overdose deaths among Yucatec Mayans living in San Francisco rose alarmingly, according to anecdotal information. It's impossible to get the exact rate of death since the San Francisco Chief Medical Examiner's Office counts all Indigenous Latin Americans as Latinx. In fact, no city, state, or federal agency keeps track of Yucatec Mayans, but as many as 70,000 may be living in and around San Francisco. That's what Candila Chan learned from an organization called the Institute for the Development of Maya Culture that's based in Mérida, the capital of Yucatan. That lack of health data on Indigenous Latinx populations is a problem, according to Dr. Ceci Aquino, the executive director of the Latino Coalition for a Healthy California. Her organization was part of a years-long campaign for change.
We're not a monolith. Our diverse communities experiencing everything from healthcare access to healthcare quality, or even just other safety net systems. We need to understand and receive data back that drills down to those specific subgroups. If we don't, then we're losing quality data that could lead us to make better decisions in terms of funding that's being allocated to the community, regionally, how it's being spread out. So it really impacts our public health strategy when we're not equipped with the right data.
Long Beach Senator Lina Gonzalez introduced the Equity Data Collection Bill last year, and it passed the state Senate. But Governor Gavin Newsom vetoed the bill last October. He said the U.S. Office of Management and Budget is updating federal standards for collecting race and ethnicity information. But in the meantime, California is required to submit data to the federal government using current standards. Aquino said the fight isn't over.
It really behooves the state to be able to take ownership, take that leadership, and practice that state power that we have to be responsive to the needs of our population. And California, it's almost 40% Latino. And that's a huge piece of the population, from our culture to the economy. And if you're not taking care of one of the biggest groups in your state and simply receiving the right information to serve and partner with the community better, then you're missing out on something that could be very valuable and could even save lives.
While data didn't alert anyone that Yucatec Mayans were dying at an alarming rate, Jorge Zepeda noticed. He's the director of Latinx Health for San Francisco AIDS Foundation. In 2020, he was working with the city's COVID Command Center to assess the Latinx population living in the city's single-room occupancy buildings, or SROs. Privately owned SROs charge from $1,200 to as much as $1,900 a month for a 10 by 10-foot space with kitchenette, so it was common to see many people living 6 or even 8 to a room. Dangerous conditions during COVID. Zepeda said that during his repeat visits, he wouldn't be surprised to hear that someone he'd previously met was now in the hospital, but then he began hearing updates that did shock him.
What I remember very vivid, these 3 people that died, they were from Yucatan. And people that I trying to understand what they were saying, they were limited Spanish speakers. I asked if they knew other people that had the same problem, that they said, our community, because they're not working, they're drinking a lot, they're using drugs. And I was asking around if we had services for indigenous communities and Spanish-speaking communities. And then I reached out to the Mexican consulate. I said, hey, do you know how many Maya communities do we have in San Francisco? And they said, well, we have an estimate. And then they said to me, also, we wanted to talk to you because lately we have to issue certificates of people dying of overdoses. And they said, well, I'm seeing the same.
It turns out the spike in overdose deaths among Yucatan Mayans had also been noticed by Remedios Gomez Arnau, the Mexican consul general in San Francisco. It's her job to process the death certificates of local Mexican nationals before they're repatriated. Arnau retired last year, and a new consul general has not yet taken her place. Before retiring, she reached out to Zepeda for answers, and he turned to the Department of Public Health.
And I was asking them, okay, so how do you organize services to provide prevention to Spanish-speaking communities? And I was asking and asking and asking, and then they said, well, we don't have information. And I said, well, do you know how many people have died of the Spanish-speaking or Maya-speaking? Not sure.
Zepeda consulted with Laura Guzman, executive director of the National Harm Reduction Coalition. They decided there needed to be a study of San Francisco's Latinx and Indigenous community. They enlisted Dr. Carlos Martinez, a public health and medical anthropology researcher from UC Santa Cruz, and got funding from the Public Health Department.
We wanted to learn the knowledge level of what drugs people were using, if they knew what they were using, and then the experience on overdoses. And then their experiences accessing services. When we were interviewing people, often not everybody knew what they were using, but they knew the effect. They wanted to keep working. They reached out to a coworker or a person that I knew, whether it's keeping working or relax or going to sleep. And when we asked them, do you know the name of the drug? No, but I can get it from a person that I know. So the results were telling us, okay, we need to be sure that our community are familiar with what are the substances and they associate a name with the substance. And also they learn how the effects of the substance in their body and the risks that they are taking. And of course, because we don't have quality control in the street market, so they need to be aware that many of these substances are tainted with fentanyl. And then we need to be sure that our community, they learn what are the risks of the fentanyl. That is very strong drug that can affect the body up to the point to die as a result of overdoses. And most of the people didn't feel confident about using Narcan. Even though that we have sources, they're not enough in disseminating information about drugs, drug use, impact, side effects, and drug health services. And then the points of entry of these services are not visible for many of our community members. And many of the service providers, they even acknowledge that they are not prepared to help or assist Spanish-speaking or Maya-speaking communities. The majority of the service providers that were community-based organizations serving the Latina community, they said that they didn't feel comfortable making a referral to a current substance use or substance health service provider in San Francisco.
Zepeda and his partners completed the study in 2022 and set about to spread the word about their findings.
We did a presentation to the Mexican ambassador, Esteban Moctezuma. He's in Washington, D.C., and came to San Francisco, and I did a presentation with the Mexican consulate and the ambassador in the Indigenous Maya. I explained the situation. We did presentations in Carecen, Dolores Street Community Services, OMI, Mission Neighborhood Health Center, and Instituto Familiar de la Raza, and also Treatment on Demand Coalition in San Francisco. We were interviewed by TV in Spanish, and we sent the findings to many people, officials, to say, hey, this is what we found. We need more education for Spanish and Maya-speaking communities about how drugs work, how they impact in the body, what are the risks. Also about overdose prevention, where they can access services, and how they can use Narcan. And you need to increase budget allocations to agencies that are providing services so they can expand their services in Spanish and Maya capacity, so they can engage with the community.
So you've put the ask to the Department of Public Health. Where are you at with advancing the progress in that department?
What I can see in the front line is that now public health is asking to all the contractors to have a plan in how to refer people that are accessing their services to substance health services. So that I did not see that before. And now they have information in Spanish. And some requests for proposals that I have seen for behavioral health, they are including asking people to apply to provide behavioral services for Spanish-speaking and Maya-speaking communities.
Zepeda said he's pleased with the progress, but a segment of the population is still falling through the cracks.
We have in-house community members. They have a history of drug use and currently are using drugs. And then we have highly functional individuals that are using drugs, okay? And I'm concerned of both because the highly functional individuals, they cannot sustain their pace. So they have 2 jobs at minimum, and they're using drugs as remedies. And some of them, they have experienced overdoses, and some of them have died. And in private SROs, we don't have services, support services. So we have these people that, because the responsibilities, they need to keep working, earning an income, to support family in the US, and sending money abroad to pay the money that they borrowed to come to this country, or relatives that they need support. And they work and they use drugs to keep going. And we haven't been able to reach out to them and say, you are using these remedies as any medication, they have risks, and you need to learn those risks. And we haven't done that. We have worked with unhoused people, reaching out to them and say, well, you need services, you should go to these places. And yet we have seen people dying on the streets on overdoses. And there are Maya communities in both scenarios, and Spanish-speaking communities and immigrant communities in both scenarios. But what I see is these 2 scenarios that I'm describing, they have different needs and different strategies to help them to learn about drugs and services available for them and how to prevent overdoses.
San Francisco was among the top 3 California counties for opioid-related deaths among Latinos in 2019, and the San Francisco Department of Public Health's Overdose Prevention Plan points out that the Latinx population's overdose death rate exceeds the citywide rate. The plan states, quote, reducing disparities and overdoses requires addressing cultural and linguistic needs in drug-related education, outreach, engagement, and treatment. The plan highlights a dire need in the Black community, but nothing specific for the Latinx community. I wanted to ask the Department of Public Health about plans for that population, any challenges they may be facing, and how success would be measured. The department declined my request for an interview, but I did get an email stating the department offers 10 beds in the managed alcohol program for Latinx and Indigenous patients, and it just launched a new initiative called Health Access Point, which provides harm reduction services to Latinx clients. It's led by the Instituto Familiar de la Raza, the Mission Neighborhood Health Center, and San Francisco AIDS Foundation. Finally, next year, the health department anticipates that a planned 33-bed expansion of a mental health and substance use treatment facility for women who have been arrested, charged, convicted, or incarcerated will be Spanish language competent. But service providers will tell you that Spanish competency doesn't amount to culturally sensitive programs, and those are nearly non-existent for San Francisco's Latinx communities. The Latino Commission is the only organization providing that kind of residential treatment in San Francisco, and they only have 10 beds. Latino Commission Executive Director Deborah Camarillo said that leaves a huge gap because connecting with one's own culture is fundamental to healing.
Indigenous people from around the world, there were commonalities in all of us, and there's basic things where we connect as humanity. So one of the things is that coming into this dimension, we have value. So there's where you see in a community, a baby's born, and what do? We celebrate. And it's not just to celebrate, it's really a welcoming to go, okay, we want to acknowledge that you're here. And in that acknowledgement, to know these are all the people that are going to support you. This is your community. This is your family. And when you have a reception, if I can put it that way, a reception in that way, all of a sudden that does something to you internally, right? And we know this by the science. When a little baby, even before the baby's born, when they can feel that and it's transmitted right through the body, and they bond and they can, feel that essence of value, then they begin to thrive. Absent of that, then they don't thrive. So as people, we understand that part. And then the other part is that there's a purpose. You're not here just for nothing. You have a purpose in being here, and a significant purpose, and especially because no one's the same. And so it's imperative that you're here and that you're part of the community of the family, because there's no replication or replica of you. You're an original. So the importance that you play. And even in that, as a person, you bring that uniqueness and you bring those perceptions. So you have teachings, you have medicine of your own that needs to be shared, but also within that exchange, then the teachings that you learn from others, because they have medicine as well. And then the place to gather. Where are those safe places that we can come together as a community? The challenge with that is that especially our young people, they don't have that sense of connection. They don't know where they come from. Some of them, for a lot of reasons, because it's not a simple equation here, right? You have people that have come and relocated to this place and they have no family. They have no community. Or you have a youngster because their parents were struggling with their own issues that they can't be there for their children. So it's multi-layered. But when you don't have that connection, you're going to find that connection some way. And the unfortunate part of that is that a lot of the times it's found in a negative way. So like a gangs is a perfect example of that, because I might not fit here, but with my gang, I fit in very well. I'm somebody. I have a purpose. And so understanding that there has been an interruption in that, and the story sometimes, and the reflection that we see outside, sometimes we can't see each other because of the racism, but the patriarchy. It's difficult sometimes to find something that I can resonate with. So coming into recovery and getting connected, when I can understand who I am, where I come from, that then creates a sense of value, right, within me. Because one thing we know about alcohol and drugs, it's just a coping mechanism. Some people might go shopping, some people might eat, some people might overexercise. It's all coping mechanisms. And there's a need that substance abuse is supplying. And so when we come into the program and we can begin to understand that, listen, we use drugs because drugs work. It sedates for a period of time. Alcohol sedates for a period of time. The thing is that it doesn't resolve anything. And so we come into a recovery and you get to connect and find a sense of self. And in finding that sense of self and building that self-esteem, then there becomes value. Because we understand at the end of the day, as humanity, as human beings, we're sacred. And in sacredness, right? If I can understand that place and I can live in that place, then my actions are going to be different. I'm not going to treat you like maybe I would treat you in the past. I'm not going to treat myself. And I'm not going to accept treatment that maybe I have done in the past. Because all of a sudden now I look and I said, okay, wait a minute. Knowing who I am, then some of those things are not okay any longer. And then the need, right? So then the need for alcohol dissipates. Those core needs begin to get filled and that healing process begins. But just like trauma didn't happen by itself, because you can't get trauma when there's not somebody else there. Healing doesn't happen by itself either. And so we need each other in order for healing to occur.
Increasing linguistically and culturally sensitive programs for Latinx populations will require more Latinx physicians. That's the goal of the UCSF Latinx Center of Excellence. Marlene Martin, the center's director of addiction initiatives, found her calling early in her career.
When I was in my first year of training, I took care of a young Latina woman who had advanced liver failure due to drinking. And I learned her story when I was taking care of her in the hospital. And then I actually became her primary care doctor at the General. And I heard that she had been drinking to cope with depression after a divorce, that she had hid like her ritual of vodka and orange juice from her family, that she was like doing her best to take care of her two daughters. They'd learned that she'd never received health care. She was uninsured, she was undocumented, and all of these different layers that added up so that she never actually got screened for depression. She didn't get screened for unhealthy alcohol use. And here she ends up in the hospital with this really severe complication of a substance use disorder. And she died a few months after I met her. And I think seeing all that she went through and taking care of her and others like her sort of since then, and seeing there are so many different things we can offer. And in the hospital as a doctor, I'm here sort of putting band-aids on people. It's what it felt like. And I imagined, what would it be like to have met this person earlier on in their course, to learn what tools I can offer, what medications, what resources for somebody with a substance use disorder, and offer it to them in the hospital. So that's how I started doing work in addiction medicine and why I pursued that as my medical specialty.
Also a UCSF associate professor, Martine co-authored a study that was published in the Journal of General Internal Medicine in January 2022, titled Lack of Racial and Ethnic Diversity Among Addiction Physicians.
What we found was that one of the groups that was least represented among the clinicians who registered with ASAM, which is the largest addiction medicine professional organization, includes Latina clinicians. One of the biggest populations in California, certainly at 40%. And then as we think about nationally and the expansion that's going to happen with Latina populations, I think it's key. And we know, it's not only about the language, it's like people who look like you understand your culture and how much that matters in healthcare outcomes, really stressing that importance.
The study's authors concluded that diversifying the physician workforce would require increased funding for medical schools in underserved communities, financial aid for students without access to generational wealth, more comprehensive loan repayment policies, and programs to expose students to medical careers. In the meantime, the UCSF Latinx Center for Excellence is partnering with other national organizations to fill the need.
What we're doing right now is we have partnered with the National Harm Reduction Coalition to build this new initiative. It is an educational curriculum with 4 Latinx, Latina community-based organizations here in San Francisco, and we are educating, piloting, and evaluating this Spanish language curriculum with a focus on substance use. And it's been really, really wonderful. I'm so excited.
Candila Chan of the Asociación Mayab is also doing what she can to help San Francisco's Mayan population through food donation, healthcare referrals, cultural activities, and community celebrations. And her efforts have not gone unnoticed. Last year, Mexican Ambassador Esteban Moctezuma Barragan visited the Asociación Mayab along with the Consul General. In early March, the ambassador invited Candila Chan to be in Washington, D.C. during a visit from the governor of Yucatan.
I had the opportunity to ask him, can you come one day to visit us? He said he will. He need attention from him to these people here. They always make a comment that the government in Yucatan, they don't care for them. How terrible is that? You know, it's very sad to hear that.
Maybe due to the spotlight on local Yucatecans, an office in Daly City opened late last year called La Casa del Yucateco. Launched by the Yucatan governor, the office provides Yucatecans with government advice and services. Candila Chan's efforts also earned a commendation from San Francisco's Board of Supervisors. During a hearing last December, Supervisor Hillary Ronan presented a certificate of honor to Candila Chan, whom many call Maestra Lidia in deference to her long teaching career.
Maestra Lidia was born in the town of Homan, Yucatan, Mexico, where she has roots in the Indigenous Mayan ancestry and Arab descent. Asociación Maya was established in 2004, and Maestra Lidia got involved serving for 3 years on the board of directors. It was during this time that she saw the importance of establishing a strong network of support for the Indigenous Mayan community in the Greater Bay Area. Understanding that many of their members sacrificed so much and suffered so much trauma to get here, often leaving behind their family and sometimes all their belongings in order to reach the American dream, only to find additional hardships and challenges here, which are challenges exacerbated by language in which Spanish is the second language for many of the members. Through Maestra Lidia's vision and city and community partnerships, the organization has made a real change for their members. Asociación Maya now offers a steady program of cultural, educational, and essential community resources, including a weekly food pantry that provides for 250 families, classes and performances of jarana, the traditional dance of Yucatan, artisan craft making, Zumba classes, an innovative Mayan interpretation training program, and the Asociación Maya Mayan Baseball League that has 8 teams and 144 players. These programs help keep the community connected, active, physically healthy, and engaged with one another. Congratulations.
I'm Sylvie Sturm, and you've been listening to Civic. Civic comes to you from KSFP LP 102.5 FM and the San Francisco Public Press. This episode was produced as a project for USC Annenberg Center for Health Journalism's 2023 Data Fellowship. Our theme music is by John Dillon. Additional music was supplied by the Blue Dot Sessions. The audio of Hilario Chicanul speaking Mayan was recorded for Wikitongues by volunteer Nat Pendleton. Our team includes producer Leanna Wilcox, KSFP Program Director Mel Baker, and Executive Director Lila LaHood. Cynthia Chavez is our vocal coach. KSFP is a project of the San Francisco Public Press, a nonprofit investigative newsroom. Find this episode, the companion article, and all our reporting at sfpublicpress.org. Reporters and civic contributors include Madison Alvarado, Zhe Wu, Jessica Prado, and Michael Stoll. Thanks for listening.